Hey everybody, it's Don and Dan here from The Clinical Trials Guru. Again, that website is www.theclinicaltrialsguru.com. Today we're here with guest guru Tawana Peacock. Now, Tawana and I met at a a pharmaceutical sponsored function where we were involved in recruiting clients for a particular study for people that were mentally ill and incarcerated. And I learned that Tawana, she's a master's level therapist, and outside of working with one of the investigational sites, she's also works inside Sing Sing prison with mentally ill clients. And I'm going to stop for a minute and let Tawana introduce herself and kind of take it from there. Hi, Tawana.
Hi, Don, and everyone that's there. Basically, as Don was telling you, I had some forensic experience working with mentally ill inmates at Sing Sing Correctional Facility here in Ossining, New York. And we had very interesting experiences there, and it was just a gamut of people and interesting stories and from different backgrounds. And it was just a great way to get some experience in the field of forensic psychology, and just a great way to really get my teeth into working with the guys who had mental health issues. A lot of my patients were, most of my patients had histories of abuse, physical abuse, a lot of sexual abuse. Most of them were, really, they had very, very impoverished lives, not a lot of schooling. We had guys who they were great people. I've met a lot of great people who they had minimal skills in terms of relationship skills, and they didn't know how to navigate themselves in the world. And then when you add the mental illness, it made it very difficult for them to be appropriate socially. And unfortunately, they learned a lot of those skills in mental health settings in the prison system. A lot of times the guys we were working with, felt like they had never been embraced ever in their lives, other than when they were embraced by our system, our mental health system here in the prison system. They hadn't addressed a lot of their mental health issues. A lot of guys claimed to not have even known that they were considered mentally ill because they were self-medicating out on the street. They were using marijuana and cocaine and different kinds of drugs. And when you took that away, they had been doing it for 10, 20, 30 years. And when you took that out and they came to prison, where they have access to it, but they didn't have ready access to it as they did on the streets, they were now noticing that, quote unquote, something is wrong.
Okay.
So it was, it was a fabulous, fabulous experience as a therapist, as a person, as a social worker. It was a great way to build a connection and teach men. It's an all-male facility, so it was a great way to teach these men just basic skills on developing a relationship, redeveloping relationships with their families, who they had burned bridges with, many, many years prior to their being incarcerated. We unfortunately I saw a lot of younger guys coming in. It's no longer a place for, hardened, older guys. We had 17, 18-year-old guys coming upstate, for 25 years to life, 18 to life. And, and it was just devastating for them. And as, again, they had never been diagnosed with a mental illness, never noticed that something was wrong. Again, unfortunately, it was unfortunate this was the first place that they were even seeking treatment or receiving treatment, and it was just a whole new world for them. One of the bigger issues that I found was that the families were so uneducated and a lot of times unwilling to embrace this concept of their child or their husband or their brother being mentally ill. And a lot of the families, and a lot of it was based out of culture. A lot of different cultures don't really understand or kind of believe in this whole concept of mental illness and therapy and counseling and medications is going to make this go away. It was almost like they just saw this, he's always been a bad kid. This is nothing, he doesn't need medication, he's just always been a bad kid. And so I found myself as like this intermediary between the patient, the inmate patient and their families. A lot of times I'm, on the phone trying to convince, family members that they are mentally ill, that they didn't walk into this park and shoot 6 people, out of the blue, that they were hearing voices or they were paranoid or, whatever their situation was. So it was a very, very interesting way to have a glimpse into this world of a person who is mentally ill, who has gone for, 2 decades at the very least of their lives without even knowing or acknowledging that they are mentally ill, and also seeing the family side of it, where they were just in total denial.
That's quite interesting. Let me back you up for a second. Just for the audience, can you give us a brief description on what forensic psychology is?
Basically, forensic psychology is the field of psychology that deals with people who are incarcerated.
Okay.
So here in New York, we have John Jay College of Criminal Justice, and they offer degrees in forensic psychology, where people actually study it's just a whole area of the study of basically people who are incarcerated and everything around there in that field.
Okay. All right. And the other thing I was listening to you talk about too, because a lot of you're saying a lot of the population you're dealing with, a lot of times they were masking their illness through the use of drugs. Do you find that most of them coming in, their crime was as a result of either drug possession, drug usage? Well, most of the time I guess it's going to be drug possession, but had something to do with drugs?
Overwhelmingly, if it wasn't drugs, it was drugs and or alcohol.
Okay.
Overwhelmingly, that was the case, and I'm specifically dealing with the mentally ill in the prison. We had, I think it was 1,700 inmates at Sing Sing, and about 600 of them were on the mental. They were on the roster to receive psychiatric and psychological services. So even if they weren't, I was on a specialized unit that only had 64 men, and that was specialized just for them. The housing was different. It was a different housing unit than the 2 major blocks. You have A block and B block, and they housed 650 men in just those 2 buildings alone. On my level, there was just 64 people, spaced out, so there was this crowd and the noise that really exacerbates the mentally ill. It just really makes it worse. It makes it the noise, the paranoia. It's just too much for them to be out in general population. So in this housing area, it's smaller, it's more contained. We're able to see them. The cells they're in single cells. They are not double cells, meaning they don't have a roommate or a bunkie. They just have the cell to themselves. So, but yes, a lot of the times, either their crime was committed while they were on drugs, or they were, drunk, or somehow or another it is connected to drug use and or alcohol use and abuse. So that was a huge issue.
And I guess some of it is environmental.
A lot of it was environmental.
Yeah.
It was rare. It was rare to see what I used to call a white picket fence story. Where it was just this person who had the best upbringing, went to the best schools, and they just did these horrible things. I mean, that was very, very, very rare. And even in those cases, it turned out that the person was psychotic, and it was somewhat of a self-defense kind of situation. But it was very rare to see someone who just, again, didn't have this impoverished, upbringing, whether it be financially or educationally, or a lot of times maybe there was a dual diagnosis where they were, they had some mental retardation along with their mental illness. Okay. So a lot of times they really didn't start out with the best of circumstances, and it really just, it got worse as they moved on in life.
So we're talking about illnesses like schizophrenia, acute bipolar.
Yes, a lot of borderline personalities.
Some mentally delayed issues.
Yes,
okay.
Definitely. Yes.
Okay. Do you have knowledge of the percentage of inmates that are coming in that are mentally ill?
I couldn't give you exact numbers. But I will say that over the years, it has definitely increased. The fact that they've been even identified, because again, like I tell you, if you ask these guys when they're coming in through reception, when they're being processed, when they first come, what we call upstate, into the prison system, they will tell you no. I mean, because again, a lot of them didn't really know that, or they were told, and oh yeah, a few years ago, you know, my mom took me to the doctor, and he said something about I had some kind of illness, but I stopped taking the meds. It made me do this, or it made me do that, or I got better, and they didn't realize that no, this is something that you are going to have to you know, be regular with. This is something that you're going to have to follow up on. And in some cases, you know, the process of them being incarcerated and coming upstate and then, you know, being locked in, you know, just kind of made matters worse. And then they would act out. A lot of times our guys would come to us in terms of the mental health department because they just couldn't be managed. You know, they were constantly fighting with the officers. They couldn't be housed even in special housing units, which we call the box, you know, solitary confinement. They would still, you know, do all kinds of things that would lead them to constantly have issues, you know, disciplinary issues. And that would be where we would evaluate them and say, you know what, and diagnose them with something that, you know, with a mental illness. And so, again, unfortunately, their first diagnosis or the first time that they're really taking this seriously would be in the prison system.
Wow. That's quite interesting. Dan, do you have
Yeah, Tawana, this is Dan. As far as clinical trials are concerned, is this study, this one that we will, that shall remain nameless, but I know which study it is this your first experience with a clinical trial?
Yes, it is.
And so they must have prepped you somehow. What were your thoughts about clinical trials before your involvement with the study, and then have they changed, if at all, since you've actually worked on the study?
Well, actually, to be honest, I was attracted to this position not because of the clinical trial aspect of it. It was actually the opportunity to work again with the forensic population. When I saw the announcement for the job, it indicated I would be working at Rikers Island and with some of the programs that kind of try to prevent recidivism or try to prevent, you know, maybe youngsters from going into the prison system. So that was really what attracted me. And then it was like after that I found out that this was a clinical trial. Okay. After, you know, now being in it 2 months now, well, going on 3 months, I'm fully invested in it because of the whole aspect of trying to keep these guys out.
I understand.
You know, keep them out of prison, keep them medicated, keep them safe, and keep the population safe, everybody out in the world safe. Because, you know, a lot of times, especially here in a densely populated city like New York, you know, a lot of our guys are sitting on the trains, and I don't know how the system is in California, but, you know, the subway system is crowded. I mean, there are like, I don't know, hundreds of people literally packed in like sardines. And this is, you know, everybody understands that, and that's the way it is, you know. But imagine if you're very paranoid, you haven't even been on medication, or you haven't been on medication in a year, and, you know, you feel like you have to carry a knife or a gun to protect yourself because you feel everyone's out to get you. And the trains, I mean, people are kind of falling on you, you're rocking back and forth, everybody's bumping against you. This is the nature of how it works. And imagine there are like, I don't know, probably thousands of people riding around like this all day, every day. You know, so the thought that someone, you know, would have these thoughts, they would be off their medication, they just got out of prison, or, you know, just had a recent incarceration, and they're out off their medication, and this happens, and knowing that when they go back upstate, that's probably going to be it, depending on what they were in for the first or second or third time. So the thought that there's some study that wants to figure this out and possibly down the road help that is what really drew me to this, to the job and the clinical trials. Has it changed my opinion of clinical trials? I respect and I like the way that this particular trial is going. I think the trials that kind of utilize this kind of, and I hate to put it out there, but guinea pig kind of method, I still have some questions about.
Right.
But I particularly like the way that this trial, I like everything, the background and the basis for this trial, and I like the way that it's conducted.
Sounds like you're more supportive if it's really there to help the population, other than just conducting a study to bring about another medication.
I like that. maybe it's just a personal style. You know, I like I like things to be done for a reason and for a purpose. And yes, when they're trying to bring about another medication, and it's of course being helpful. But again, maybe if other trials can be conducted in a way that will be useful in a broader, base, maybe kind of for everyone, because I think the benefits of this trial is that, again, not only does it help the patient with their life, it kind of helps society, in general. It kind of just has this multi-use purpose, but that's just my personal style.
Well, that's okay. That's what we're here for. So.
Yeah, I mean, there's no right or wrong answer. Now, the trials you're referring to that you're not so fond of, I mean, I'm sure some of your patients have been targeted for other trials in the past. Am I correct?
Do you mean the patients that were in the prison population, or just in general the patients that I'm coming across now?
Yeah, just in general. Like, were they ever approached for other studies, and then what were your feelings on that?
I haven't really gotten any feedback about them being approached by other studies.
Oh, okay.
Maybe they just haven't told me, or I really haven't gotten that to be, a big issue.
Are there a lot of investigational sites conducting the CNS studies in your area?
Not that I'm aware of, but again, I'm not in a field where that would be the case. Excuse me one second.
Okay.
So I may be the wrong person to ask that question.
Okay.
I haven't come across that a lot.
Because that usually makes the difference. The more investigational sites you have conducting the same type studies, then the more after the same population. And of course, what we found here in Southern California, especially in the LA area, you get a lot of repeat clients that are just trying to bounce from study to study.
Right.
And you have to kind of be aware of that. For us, at least we do.
No, I haven't gotten that feedback.
Okay. Now you're doing private practice right now. Are you just strictly working with the investigational site?
No, what I do, back in January, we had some, New York State had some budgetary issues. So I was what we call bumped from Sing Sing to a psychiatric hospital. So right now I'm actually working in a psych hospital.
Okay.
With the hopes of going back once things kind of, the smoke clears with budgets and whatever. So I would love to go back to my work at Sing Sing.
Okay.
But right now I'm working in a psychiatric hospital. I do that, and then I do the study with a sister psych hospital on Mondays. That's what I do.
Okay. All right.
Yeah, no, it's pretty good so far. Thank you, Tawana, for your time here.
Yeah, this is, like I said, it's quite as interesting as I thought it would be, because that's some interesting information. And you're right, I think it goes right along with what this particular sponsor is looking for. Because I remember attending some of the original recruitment meetings, and they had different representatives from the federal level on the mental health, and they were talking about the amount of money that's spent in the penal system on clients that are I'm so used to using that term, clients, on inmates that are mentally ill, just for the reasons that you stated too. That whole environment just seems to exacerbate their illness, and they end up, you have to treat that when they're there.
Yeah, and the thing about it is that it's so unfortunate. Quite honestly, I'm working on this study, but it's like I already have the answer because I worked there for almost 6 years, and it's like you see the same guys coming back and forth to prison, or they've had 5 or 6 bids. I mean, they've been in prison most of their lives, and overwhelmingly you hear, Miss Dick, I was doing fine. I was out. I had a job. I had a girl. They had all the things that they think life is about. And I said, well, what happened? And stopped taking my meds, started getting high. You know the deal, Miss P. And it's just the same cycle over. It's like I could just write the book. I could play the tape every, when I talk to them. And so I mean, I'm sure that I know that the company is spending a lot of money and a lot of time and a lot of energy in trying to answer this question. If they were on something that would sustain them over the course of a month and they wouldn't have to remember or be told to take their medication, would that help them stay out? Would that decrease recidivism? I can tell you that right now. Yes, a million percent. Yes. But it's just something about, even when we had our guys housed, it was, we would have them stable and they were receiving services and we were seeing them every day and we would hang out with them and play cards with them and they would be doing wonderfully when they were medicated and following the treatment and therapy and everything. And then, all of a sudden we would just see them go down and come to find out they had been cheeking their meds for, a month or whatever before it really, it would be a while before we really noticed it, in their system. And they would stop their medication. Why? And they said, because I was feeling better. I didn't need the medication. Yeah. And it's just amazing to me that they don't draw the connection between you were feeling better because you were taking the medication.
Right.
Not because you didn't need it. So it's just, I don't know.
And this study is a perfect example of clinical trial that's, not necessarily testing a new medication, but just looking for some supportive data, that they can make more claims. So when people think of clinical trials, they usually think of these experiments and then, compare it against placebos. And in this case, this is a perfect example of a clinical trial that does not involve either one of those two things. So, it makes it an interesting study and a unique study, and it lets everyone out there know that not all trials involve placebos in our experiments.
Exactly. I actually like to market it as, we're doing basically a study on recidivism and how to, avoid it.
Right.
And so I don't like to go and say, well, we're trying this medication because as soon as someone hears that, it's like, they close the blinds, don't come back,
Right, yeah.
Right, because that's kind of the way I view it. I view it as, an exercise on how do we cut down on recidivism. And, having guys come once a month and do it that way is a better way of, maintaining them on their medication and treating them versus relying on them to take their medication twice a day and have all these different pills. And, it's just not realistic and practical. It really isn't.
No, not for that population. I agree with you, too. Which brings another issue. I think the fact that if you're able to get an injection versus taking an oral medication for certain people that work a whole lot better.
It does.
Because, again, they can't stop taking the medication. When they get the injection, they're actually confronted by someone on their condition and how they're doing, and bam, you can give them another injection, and they're going about their business.
Right.
And they're back another 30 days. I think that's a whole lot better. Well, we appreciate all the time you've given us. If someone has any questions for you, is there a way for them to reach you?
Sure, I can give you my email address.
Sure, go ahead.
It's T as in Tom, M as in Mary, P as in Peacock, 32272 at AOL.com.
All right. There you have it, folks. Again, we're here with guest guru Tawana Peacock, and quite an interesting story. And if you have any questions, you can reach her at that email. And again, we thank you for listening. This is Dan and Don signing off from The Clinical Trials Guru. Again, that website is www.theclinicaltrialsguru.com. Thank you.